Good morning and a very warm welcome everyone to this much anticipated collaborative forum. Join the dots, strengthening connection with community and building networks. My name's Tracy Blythe. I'm the Executive Officer of the Inner East Primary Care Partnership. On behalf of the board of the Inner East PCP, I'm really pleased to be able to sponsor this regional event in partnership with the Eastern Metropolitan Community Engagement Interest Group, comprising public health, community health and community sector organisations across the East. Before we begin, I would like to acknowledge the Wurundjeri and Bunurong peoples of the Kulin Nation where I am based, and also any other First Nation traditional owners on whose unceded lands our online gathering takes place today. I pay my deep respects to all elders and recognise the harmful impacts of colonisation on our First Nations people and the sorrow of the stolen generation. I also recognise and value Indigenous knowledge, wisdom, strength, resilience, and their ongoing contribution to the health and wellbeing of the whole community. I would like to also acknowledge the Department of Health and Human Services for the funding to enable us to bring some really inspiring speakers into the region to support our partners build capacity in good practice community engagement and enhance their work with our rich and diverse multicultural communities. I'm excited to welcome and thank Dr. Carolyn Wallace for supporting the forum as our keynote speaker. Carolyn has conducted extensive research into the concept of community connectors, and I extend my appreciation for sharing her guidance, particularly in successfully engaging with the hardly reached groups. I also welcome and acknowledge the privilege we have to hear from the lived experience of 6 local community connectors who informally and intuitively see the opportunities to strengthen connection across the community and actively reach out to join those dots, building harmony and enriching our region. I would also like to recognise the important work of the award-winning Opening Doors program of our partner Link Health and Community and coordinators Alex Mills and Marisa Bryant, who have been instrumental in supporting community members to become active community leaders, and that some of the connectors that you'll meet today are proud graduates. Andrew Guy is also an experienced connector and he'll be our Master of Ceremonies today. So thank you so much, Andrew, also for joining us, and to our connectors for your support and the generosity of your time to share your insights. The Inner East Primary Care Partnership is funded to strengthen partnerships to maximise population health and wellbeing and reduce inequality. Our mission is to be a dynamic organisation working to drive transformational change, including to promote and increase social inclusion. One of the ways we achieve our aims is to contribute to the building of leadership and workforce capability of our partners, and by connecting up the expertise within organisations. This topic today sits firmly with our strategic direction, and it's really terrific to see the forum come to fruition. I'd also like to take the opportunity before I close to especially thank our staff who've worked behind the scenes to plan this event, and especially Kate Jeffrey, our Access and Inclusion Coordinator, for her extensive passion and enthusiasm in leading this work, and for her support to the Community Engagement Interest Group's activity. Thank you, Kate. I'm now delighted to introduce you to Mr. Wei Tai, who has been invited to formally open the forum in recognition of his extensive and active community engagement in our region, and as a highly respected community leader who came to Australia as a refugee from Burma. I would like to congratulate Wei on recently being appointed to the position of Deputy Chair of the Victorian Multicultural Commission. Wei has supported the planning of this forum today and believes strongly in partnerships and building networks, both in his role in the community with the VMC and as Migrant Program Coordinator at Swinburne University of Technology. So it is with great honour I would like to welcome Wei Tai. Thank you. Enjoy the forum.
Thank you, Tracy. feel very privileged to be here. I can see 93 people have already joined in, so this is fantastic. Uh, a special thanks to all the organizers for having me. Good morning, and thank you for this opportunity to be part of this important forum, Join the Dots. And as a community advocate, I cannot stress how important it is in terms of bringing people together, like-minded together, to work cohesively so that our communities can be empowered. I would also like to begin by paying my respect to the traditional owners of the land on which I'm speaking from, and I pay my respect to the elders, past, present, and emerging, and celebrate the diversity of Aboriginal and Torres Strait Islander people and their ongoing culture and connection to the lands and waters of Victoria. I would also like to pay my respect to any Aboriginal people who are attending this event today. Would also like to acknowledge Tracy Blake, the CEO of Inner Eastern Primary Care Partnership, and to Dr. Carolyn Wallace, keynote speaker and General Manager, Family and Community Health at Mary Health. And I very much look forward to her presentation. On behalf of the Victorian Multicultural Commission, I congratulate the Eastern Metropolitan Region Community Engagement Interest Group, and I know it's a mouthful, and the Inner East Primary Care Partnership on organizing this important forum to talk about the concept of community connectors and how this can strengthen relationships with the community. I am glad to be here today to recognize the importance of building connection with multicultural communities. The Victorian Multicultural Commission is the main link between communities and governments, and our role involves strengthening cultural diversity in Victoria through consultation, advocacy, celebration, and promotion. At the Commission, we see every day how strengthening partnerships with multicultural communities improve access to services and outcomes for inclusion. It is great to be involved in a forum that not only explores how to better connect with multicultural communities, but also generate practical strategies that you can take back to your workplace. I'm thrilled to see so many agencies, service providers, community members come together to share their experience to help improve how agencies can connect better with communities. Collaboration is fundamental to understanding what our multicultural communities need and how we can better support them. The coronavirus pandemic has highlighted how important it is for information and services to be tailored to our multicultural communities. A key focus for every organization should be on improving how to reach your community members and how to make your service more accessible. Engaging with community connectors allow you to receive feedback that is reflective of the community and will enable more inclusion with your services. I know the challenges of accessing service, and I reflect on um, my own personal journey as a refugee migrant um, about 11 years and a month ago, being new to this wonderful country and excited, but also realizing and not knowing what lies ahead, exploring the unknown territory. And so I have seen firsthand to a certain level uh, that things we might not consider as barriers could be those blockage for our communities in accessing our services. And as a community advocate, I've been very passionate in advocating to seeing ways how service providers can hear the voice of our communities. And 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 I believe that there is with our collective effort, these barriers, big and small, uh, can be removed. And that's why part of it is that I joined the Communities Council on Ethnic Issues Eastern Region quite for some time now. It is a small organization, but with a big heart. And last Sunday evening, we saw the Multicultural Twilight musical concert. And through these little things that we have done, we were able to connect with over 25,000 people. And, it's just amazing. Every effort matters. And so every organization, the effort that we put in, it all matters to our communities. And that is why, because of all the services, I am who I am today. And I give uh, my utmost gratefulness and thanks to all the service providers who have touched my life and inspired me to be where I am today. I have seen firsthand the effectiveness of working in partnership. And I always say to those that I come across, a relationship should be of mutual benefit, of ways how we can work together and be inclusive. Words are powerful, and 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 so does listening, the capacity to listen. But to action it is even more empowering to our communities. COVID has impacted us at all fronts, both negatively, and has created so much challenges. But it also gives me an insight into this very notion of co-designing. And in recent times, I've been able to hear um, the opportunities of co-designing programs to meet our community's need. And this excites me. Uh, it is not about how we experience COVID pandemic, but it is about how we come out on the other side and how stronger we can come out. And I believe, and I genuinely believe, that we can make this experience to bring us more stronger, more connected together to address the needs of our communities. We can do, we can all do more to engage networks of community connectors, and giving voice to the voiceless is critical. And due to COVID, we've seen that our communities have been able to raise their voices. And to a certain level, the VMC has been facilitating that. And so I feel very, very privileged to be part of that journey and that step in moving forward. I encourage you to consider how you can use the learning from today to reach communities that are hardly reached. And through COVID, we have seen how communities have been left out, how there are still pockets of communities who are really struggling, and every effort counts. There are many community connectors like myself, uh, and I regard them very highly, and I'm very inspired by them. Um, and so this is an opportunity for service providers to see how you can better work with them, how you can better co-design your programs with them. I hope that this forum will inspire you to explore ways to engage our multicultural communities, but also come up with real solutions and friendship and relationships that will address the needs of our communities that we serve. Thank you all once again for inviting me to this very, very special event. And I look forward to hearing from everyone, including the keynote speakers. And thank you and have a lovely, lovely day.
Cool. Um, Thank you very much, Boy, and thank you very much, Tracy. It's now my time to take the gear, and hopefully I drive the car smoothly during the day. Everyone, my name is Andrew Guy, and I am very proud to be a community connector. And I think from the get-go, I say thank you to Dr. Carolyn Wallace for giving me the identity and the title. I did not know about this term until a month ago, and I actually liked it to be a community connector. I am a South Sudanese Australian, and I'm only saying that so you don't have to wonder where the heck is his accent from, because it's been linked to some other places in the past. But I have to say how privileged I am to be the MC for today. And I'm very thankful to the organizing committee and to Fiona Reid, who I'm not sure if she's with us today, and the supporting organization, as you can see on the flyer. I am very excited that you are all here today, and I'd like to thank you for turning up. Although some of you are turning up in your own houses, which is one of the benefit we may take away from this. That um, it was never part of our planning to think about how long are people going to drive or where they're going to be parking their cars. So we're just turning up from our own homes, and we we would like you to, just reiterating what Boy said before, to hear our voices today, and the voices of how we as services can better engage the communities that we work with. And I just like to share my screen and just take you through a bit about why we are here today. And then from there, I will hand you over to our keynote speaker for today. If you have seen the flyer for the event, that would have really given you a really very good snapshot of what today is about. And today we are coming together to have a chat about the important role that we the community connectors play in linking our communities with the mainstream services and organizations. And why we're here is today, at the center of today's forum are the voices of the community connectors. We also want to provide just an understanding of the guidance on how to help organization to be community connector friendly. And that is to improve that relationship between the community connectors and the services providers themselves. We also want to, I think we're all going through this, we're all going through the same screen that I'm looking at there. Yep, cool. We also want to understand ways we can reach out to the hardly reached. And if you've seen that term before, there's been a shift there in the narrative. We usually say hard to reach, but we're now changing that to hardly reached communities. We also want to highlight and also respect the importance of boundaries from community connector perspective. And you will be hearing from community connectors later on during the day. We also want to build understanding of community perspective and ways we can work together with communities. Let me take you through the today agenda, which is we've already gone through the welcome and introduction. I will introduce to you shortly our keynote speaker. But the important thing is that as you're listening to Dr. Carolyn's presentation, and also hearing from our community connectors who will be sharing their stories today, you may have questions. And those questions will strongly encourage you to jot them down and also put them in the chat box. There are people who are looking into that and will be looking at those questions, and some of them will be putting them through to be answered by our keynote speaker today. We will have lunch. You will provide your own lunch where you are, and that is just a break for for all of us from the screen, where you can walk around and just stretch. And we also really ask everyone to, if possible, to just leave, to not disconnect from Zoom when you're taking break during your lunch. The other thing is, as you're hearing from us, we also want to hear from you as well. So we'll be breaking into magical breakout rooms. That first time I heard about it, first time I was part of it, I was like, where are they taking me? And then at the other end, you ended up with a group of people. And that is so that we can reflect on what we've heard today and also explore how we can make sense of today's discussion and the things you'll be hearing. After that as well, you also have opportunity to catch up with two other people to talk about the commitment from today. And if there's anything we can say a lot today, is that this is a call to action. It's a call to action event where, you know, we hear a lot of time that knowledge is action, knowledge is power, but it's actually the application of knowledge that is power. And if we can take the knowledge of today and put it into action, we'll definitely see how we can improve our services to the people that we serve. I'm sure many of you are aware of Zoom etiquette. I really like these fellas, but to make sure you guys are aware of some of the things that are important today to make the session run very smoothly. We also like to let everyone know that the service is the program and the forum, I should say, forum is being recorded. And that's because so that we can go back to it later and also for future purposes as well, training purposes. Also to remember 2020, the event that we do, we will also take a screenshot. And if for any reason you don't want to be part of that photo, please let us know in the chat box. Also, as part of the recording as well, let us know also in the recording as well, and the team will make sure that I don't know how they will do it, but make sure that you're not in that. Also, when you're not talking or asking questions, please mute yourself. If possible, your last name and your first and last name and organization. And you can do that by moving the cursor to the top right of your small screen, and there will be 3 dots there, and that will allow you to change your name by putting your first and last name and organization if possible. Use the chat box. I can see a lot of really good reactions in the chat box already. So please make use of that. That's where you would put your questions, like I mentioned before. We really encourage everyone to be participating, but also be mindful of each other as well. And that is being respectful as you do that. If you need any technical support, there will be a link and contact number that I hope is already been posted or it will be posted. And that's where you can ask for help. Most important part of today is enjoy, enjoy, enjoy. Now comes the time to introduce to you our keynote speaker for today. And that is none other than Dr. Carolyn Wallace. She's an avid community connector in her personal and professional life, working extensively to promote inclusion among communities in rural and city settings in Victoria and Ireland. She's an experienced manager and leader in health, community services, and local development. Her recently completed PhD culminated in the development of the Community Connector framework, illustrating how health and social care professionals can tap into the boundary spanning work of community connectors and improve access to services. Dr. Carolyn is currently the General Manager for Family and Community at Mary Health. Dr. Carolyn Wallace, take it away. We'll look forward to the presentation.
Thanks, Dwayne. Well, the first thing I've done is get myself off mute, so I'm off to a flying start. Then my next challenge is to share my screen, and I've done that as well. So I would like to also acknowledge the traditional owners of the lands on where we're having our meeting today. And a big, big thank you to the organisers of this forum, especially the folks from Link Health Community who got the ball rolling, the Community Engagement Network of Practice, and the awesome connectors who are all here today. Just so you know, I'm I'm not looking at you, I'm looking at my screen. And it is a strange way to present when you don't have that energy of the audience looking back at you. But I know you're there. I've seen your friendly faces before, and I look forward to interacting in the Q&A part of this. So what I'm going to present today is a framework and a model. So what a framework, it's a handy thing. What a framework is it gives you a way to think about something, and then a model gives you a way to put that into action. So why can't I? Here we go. But before I kick into that, I've got a question for you. And I want you to think about what makes you uncomfortable. And to help you with that, I'll give you two examples, one from a social setting for me and one from accessing services. So over 30 years ago, I was traveling around Central Australia with some friends. We'd been camping. We were sick of cooking our, pasta over the stove in the campground. So we thought we'd go to a pub for dinner. And it was a little outback pub. We opened the door. I stepped forward, opened the door. There was a dartboard behind the door, and looked into this room of older men. They seemed a lot older at the time anyway, who stopped talking, looked up. The room went quiet. It was quite a small room. I didn't cross the threshold. I went back and we had pasta for dinner. That was a social setting where I felt very uncomfortable. In terms of an organisational setting, again, a few years ago, all the women in the audience know every 2 years we get a letter saying we need some screening. Off I went for that. I had rung the doctor's practice. I'd said what it was for. But when I got there, the doctor was really kind of grumpy. I didn't have time to do this now. This is the end of the day. She asked me a whole bunch of questions that I found quite intrusive. She inadvertently uncovered an issue that was quite problematic to me. I left that appointment, sat in the car and cried. I never went back to that clinic, and it took several reminder letters a few years later to get me back for my next screen. So things make us uncomfortable, and there's a reason why I've got you to think about this, and I'll get back to it. So what I want to cover off in my time this morning is this community connector framework. Why people are hardly reached, how the framework is developed, and what does it actually look like. The stars of the show, though, of course, will be some connectors that we'll meet, and they'll tell us about their motivations and some of the hardly reached groups that they interact with. Now, you're only going to hear short intros from connectors during the presentation this morning, and that is really a taster, and I urge you to stick around after lunch, because when you go into breakout groups, you'll be with a connector and get to have a lot more deeper conversations with them. So please stick around. So after we've heard from two connectors, I then want to really take you to putting it into practice. And that's where we get into the model and what it actually means for us as service providers to have connector-friendly organisations and practices. Then we get to meet two more connectors. I'll wrap it up, and Andrew has the great challenge of fielding the Q&A, so good luck with that, Andrew. So off we go. So I've got a few conceptual things. I did tell you a framework is conceptual. I want us to start thinking about, why do we need this framework? Well, it's because we've got people in the community that get on with their lives, as we all do, but now and then we need or require or want services delivered either by the public sector or maybe by private business as well. And I want you to think about, because this framework, it actually focuses on the boundaries that occur within these sectors and also between these sectors. So when I talk about public sector, I'm talking about local government, health services, any health and community service, that's our focus today, that are funded by public money. But increasingly, there are more private services too, delivering health and community services. So equally, we can think about boundaries within those settings as well. When I talk about community, I'm talking about individuals, but I'm also talking about the way we come together within our community spaces through social groups that are structured or also quite informal at times. So you're going to hear a bit from me today about boundaries, and that's very intentional and really sets up this whole framework. So boundaries are markers of difference. They are the things that define who we are and what we do. They define us at individual and collective levels. And they're really important for defining those groups, but boundaries also can cause exclusion. So think about that situation I got you to reflect on your own situation, or what makes you uncomfortable. Because having to cross boundaries, whether they're social or organisational, can make us feel really uncomfortable sometimes if we're not good at it, or if the boundaries are tougher than they need to be. And not only that, boundaries really can form the basis of categories that then marginalise or exclude people. And that's how we end up with people being hardly reached by services. So I've encouraged people to think about boundaries in 4 kinds of categories. Organisational boundaries are the sort of day-to-day ones. They define a lot of us are comfortable with. I'm back in my workplace today, which does feel a bit weird. Organisations, we're bound by our mission, our values, our strategic plan, our codes of practice, our disciplines, our technical language, our uniforms, our service guidelines, our standards, all those things. They say why this organisation exists, what it does, and who can use it and who can't use it, those sorts of things. Social boundaries, well, they're the way we categorise people according to things like, income, gender, employment, age, education. And they also then influence the formal and social groups that people belong to, which are more part of our cultural boundaries. Obviously, today we've got to focus on multicultural communities, but I really encourage you to think more broadly about the way we talk about cultural boundaries, because they're just the ways, they're the values, the norms and the beliefs of any group. And we express them through the way we talk, the clothes we wear, the music we listen to, and obviously are influenced quite often by our ethnicity as well. Physical boundaries, I'm getting you to think about them in the ways that they can impact on services. So the location, transport, the visibility, the disability access, opening hours, building designs. And it's been interesting, we've all lived through what feel like physical boundaries, the ring of steel around Melbourne, our 5K radius. It's actually not a real boundary. You can cross it. I think my husband might have once or twice, and he didn't die. But if you step over that 5K barrier, it is a boundary nevertheless. It limits our physical scope of where we can actually go. So boundaries. Take you to my next one. So the reason why people don't feel comfortable to approach or access a place, it's because they feel judged or they're made to feel different. What community connectors are so great about is they are the sort of people who they actually notice unseen and hidden boundaries, and they're responding to people, not to categories. Often when we're we go for a funding application and you get the list of, it's for older adults, people with disabilities, and we list off a bunch of groups. I don't think many of the community connectors would tell you they walk around with that list. They're actually just noticing and engaging with people because of a need that they see and an opportunity to respond. So I have quite a specific definition of community connector, and we've got some here, and as Andrew said, he's been out in the world doing all kinds of things, never actually had the label or the title, and that doesn't matter. It actually doesn't matter, but it's useful for us as, if you want to work with something or you want to find something, you've got to know what it looks like, don't you? So that's why it's useful having a definition. So I would say a community connector, they're community members who notice who's not connected in their community and they do something about it. They connect people with other people, with information, resources and services. Now you can see I've actually talking about what connectors do, but also this thing of places and objects. So the value of places and there can be places as well as people who are community connectors. Places and objects can help with connections as well. They might have different meanings to different people, but they will draw people together across social and organisational boundaries. For example, a community garden is a great example. From a health service point of view, it's a way of providing healthy food and running nutrition classes. Someone else's point of view, it's a place to go to get out of your crowded apartment. Someone else, it's a place to get free food. Someone else, it's a place for the kids to run around. For someone else, it's somewhere to learn about permaculture. We're there for different reasons, but it's bringing people together across social and organisational boundaries. Or that little tiny rainbow sticker you see on the front of some organisations. Maybe to the person who put it there, it's good, that meets our accreditation standards, I'm happy. To someone else from the LGBTI community, it means, oh, good, this is a place where they'll get me, they'll be friendly. To someone like me who's not from that community, I think, cool, this is a place that's done a bit of thinking and is friendly and inclusive. So it's already helping us cross some boundaries. And places, we're talking about places like, you know, op shops, social media is a place, a very friendly and unfriendly place at times. You know, libraries, men's sheds, sports clubs, faith communities, so many examples of what I mean by places and objects. I mentioned the rainbow sticker, but, you know, flags, art, symbols, they're all ways that we can create connection. And the beauty of community connectors is they're very adept at using places and objects to connect people as well. Very short example, a woman, a community connector I interviewed in Ireland, she realised that she was trying to draw more people into the op shop and make it a place that everyone would come to. So she got the op shop, got the contract to provide the school uniforms for all of the town. So then it brought everyone into the op shop, and then also the staff there then had the opportunity to kind of get a sense of where some people were maybe not travelling so well, link them into local services and supports. So a very practical way of how a connector used a place to really link people up to information and support. So how do I know all this? Well, this is all based on an international case study that I conducted over 2017 to 2019, and it was in rural Australia and rural Ireland. And it was instigated by a health service in the western part of Victoria, who approached Swinburne University, which is where I've undertook and completed my PhD. And good to hear, Bway, you have a connection with Swinburne too, by the way. And they had seen a couple of people in there. They knew that there were people still hardly reached by some of their services. They had a range of health and community services. But they also had seen there were some people in their community who had really drawn people in to existing groups, established new groups to bring people together. And they tapped into one, especially a playgroup of mums that had started because they weren't comfortable in the mainstream playgroup, formed another one, and they heard about it, found the connector, and they could bring, for example, their dietitian to that playgroup. So they thought, oh, there must be more of these connectors out there. How do we find them? They definitely have relationships with hardly reached people. They definitely know how this place works. Would they be open to having more formalised relationships with us? And how much do they know about health, and how willing are they to share health information and resources? So that really formed the research project. And so off I went. So I found connectors in a couple of different communities in this place in Australia, and then I went to Ireland. And so you have an international comparison, and that's also a place where I've worked and I have some leverage and some local knowledge there. And I managed to find connectors by knowing what I was looking for. And I'll just mention too, in the first setting in Australia, I actually called them, I hadn't quite landed on that term, community connectors. It was starting to be used and a lot more common in practice, and was seeing it pop up. But I was actually using the term community boundary spanners, because, you know, I told you at the start how you've got a range of boundaries within communities and also boundaries between communities and services. So community connectors or community boundary spanners are very adept at spanning those boundaries and as we're saying today, joining the dots, but sharing information and introducing people across boundaries. So in Australia, I set out looking for community boundary spanners, and I basically did that by contacting school principals, counsellors, the managers of the local media, the local newspaper, church leaders, manager of the community house, the pub owner, the chair of the business association, staff, other connectors. So all accessible public leaders, the people who are likely to know how the place works and who are likely to know who community connectors, who would be in this case, the community boundary spanners. And I asked them to introduce them to me, and replicated the same process in Ireland. what happened though, in sort of negotiating, working with a local organisation there and getting a site to do the research, the immediate feedback was, we're not happy with that term, community boundary spanners. If you're calling someone a spanner, that's like calling them a tool. That's not, doesn't fit. And so because I had seen increasing use of the term community connectors and it fits well with what I'm doing, I made that shift. And so you'll hear me for the rest of today just talk about connectors, but that's sort of how that came about. So from that process, I interviewed 32 key informants, or, you know, the pub owners, the councillors, the mayor, all those sorts of people, the principals, 19 different staff. And through that, I managed to have introductions to 32 connectors. Why I'm showing you this slide is now, and the next two slides, they're about the evidence. So what I'm going to tell you a few times today is, you'll hear me saying stuff and you'll probably go, yeah, we know that, Carolyn. We actually do that stuff. That is what we do. And I know that too. The trouble is, even because something makes a lot of sense and you do it, doesn't mean you get funding for it, policy acknowledgement of it, and, you know, the organisational support for it. So it's been really important to have the evidence so that we have an evidence-backed framework for practice, because that's stuff that you can describe, you can fund it, you can measure it, and that's what we need. So we've got some evidence. Don't worry, the slides will be available afterwards, and you can go to my website, boundaryspanning.net, and there are links to some journal articles. This particular set of data is all in this article that I've referenced here. It's open source, so that is cool as well, because anyone can get to it. So help yourselves to that. I guess the point of this slide really is to show that across these two different sites in Western Victoria and in the south of Ireland, in rural Ireland, I used quite a simple process to find quite a diverse range of connectors with a range of lived experiences and life experiences, and crossing quite a range of boundaries within their community. And as I've then developed the framework and put it into practice in my own community, working with Link Health, and now where I'm at Mary Health, I've seen the same replication of the motivation of connectors, the sort of common characteristics and common actions. So I could say, even though you might have I didn't have anyone in their 90s, but did have a few in their 80s, you know, an 83-year-old or a 37-year-old connector, they're all identifying people who are hardly reached in their community, people who are not connected to the social and to their community life. They all do something about it. They connect with that person, and they all provide some kind of support, whether it's social, emotional, practical, education, advocacy. They might provide that themselves, or they'll facilitate some other way of people obtaining that. The important thing, of course, so there's kind of a few stages to it. So what can you find connectors? Yes. What do? Well, they see people in need, they connect them, they support them. But are they actually doing stuff that's useful? Well, from our point of view, from health services. So when I looked at the kinds of health activities that the connectors in this sample were undertaking, they were some are quite sophisticated actually, but nevertheless all more at the practical end, less sort of joining committees and planning sessions and that sort of thing. But there was a little bit of that as well. In terms of their connections with health services, so 26, which is almost all of the connectors, had some sort of relationship with at least one health service, and only 6 didn't. The 6 who didn't said, well, we would really like to, we're just having trouble knowing who to go to in our own community. Services aren't that visible or accessible, and I just kind of don't know where to go myself. And of this 26, they also said, you know, I wouldn't mind having some more entry points into the local health and service system. This is really where you can see there's quite a lot of opportunity, I reckon. So when I looked at the kinds of health initiated activities of connectors, so starting a keep fit group, wanting to get fit and putting it out on Facebook and saying, come and join me, or starting a free kickboxing for kids after school because realizing not all kids were accessing sport, or forming their own walking group, or starting a suicide prevention group, whole range of, or inviting the local health service to the men's shed to bring information to the men's shed. So most of those things were initiated by connectors, and there's a lot more opportunity for health services to find connectors and undertake that work as well. So I am just watching my timer here. I've got 2 more slides to present to you before we meet our first 2 connectors. So I want to, this is what I describe as the Community Connector Framework. Ta-da! You can find it at this, this is where it sits on this web page. And so what it does is starts with this concept of boundaries. So I've talked you through that. You need to kind of start there, because that is, why are people hardly reached? Well, it's because of boundaries, categories, physical, cultural, the whole range. Isn't it awesome though that there's people in our community who are community connectors? They know how to cross boundaries within their communities to connect people and connecting people up with services. That's what they do, and they use places and objects in quite clever ways to enable that. The further good news is community connectors often are and are very open to working more with organisations. So this is where we get to the model bit, which I'll talk about after we've met our connectors. How do you actually do that? And if you are working with connectors, well, you better be measuring it, because you're enabling staff time to build these relationships. What differences will you see? How will you measure those for the hardly reached people you've connected with? There are actual benefits for connectors, and they all talked about that. People, we all do something because it gives us a buzz or a kick, or it makes us feel the world is a better place as well. And that is important. Connectors have got job opportunities, learnt more that helps them run their own business. You'll hear a range of benefits. Organisations, as Andrew said, the point of connecting, and Boy said this too, is so that our organisation can be more accessible to more people. That's what we want. And harder to measure are benefits to the broader community, but I think that's worth remembering. There are those longer term benefits to look for. I, as you might have worked out already, love diagrams and frameworks. I actually find this is, to me, this is kind of like a map. And even though the reality is way more messy, it's useful to have this to start with, because it helps you point to the bit that you're talking about. So, and especially as we are now seeing, and it's great, a lot more people who are in paid community connector roles. I argue though, paid community connectors are doing a different function to the kinds of connectors we're hearing from today. But also, some of these people end up being paid connectors, some of these people go back to doing that. So it's not that clear cut, but let's pretend it is, because it gives us a starting point for thinking about how do we work with unpaid connectors. And we are seeing a real increase, as I said. For example, with COVID, there's a statewide DHS-funded initiative called CASI, which is Community Activation and Social Initiative. So there are paid community connectors now in every local government area, which is great. And their challenge and opportunity is to find all the less visible connectors in their community space. So there is potentially a risk that we're trying to professionalise connectors, and that would just sort of take us back to where we started in a way. And really what today is about is saying, how do we tap in to the amazing resource of community connectors, so that more people who are hardly reached, and even sort of disconnected within their own community, how do these guys get better access to our services? So what I would love to do now is I'll stop sharing, and we are going to hear from Dilnaz. Dilnaz is going to tell us a bit about why you a connector, and what sort of things do you see have you noticed that mean people are hardly reached? Hi, Dilnaz.
Hi, Carolyn. Thanks for having me here in Aris PCP, and everyone. Welcome. My name's Dilnaz. Salam, namaste, ni hao, marhaba, hawala. So just saying hello to all of you all. I think it's really important to remember that community connectors, it's a great title, but as Andrew said, many of us have been doing this for a while without realizing that this was a defined role. My case is a little different because I don't work with any particular organization in the sector, in health or social service or community. I'm a banker by profession, but through my profession, I saw the need for people trying to access services.
What's your
And the-
motivation to be a connector, and why are some of the people you work with hardly reached?
Yeah. Hi everyone, I'm Sebastian, and I wish you all well and be safe. And yeah, and also again, thanks IEPCP and Caroline for inviting me to share my story. Yeah, my name is Sebastian, and actually I'm representing Build on the Rock. It's a graduation project of Opening Door. And Build on the Rock is actually a not-for-profit organization that use a social media platform called WeChat to support the Chinese new migrants to know where are the accessible community support. In fact, I'm not from any social work background. I'm an entrepreneur with a business development background. So we are all volunteer on what we are doing. Well, before Build on the Rock, I used to work in Medibank Private in Box Hill branch for 3 years. So I had an opportunity to hear 1,000 of Chinese migrants complaining about where to get helps when they, when they're facing difficulties. And I'm a person who loves to help people and, and dreamed about to make the community better. So, and I'm a Chinese migrant myself, so, and I understand how they feel, and I would like to, just to do something about it. And so after the graduation of Opening Door in early 2017, we have conducted a survey with 219 Chinese migrants who came to Australia under 15 years to understand where it goes wrong. And we found that so many critical informations. For example, like 63% of participants mentioned English and culture is one of the main barrier, and 79% have little or even no knowledge about community services. But one thing I find very interesting is that 67% of participants said they use WeChat as the information channel, and it ranked number one, whereas only 59% from friends and little as 13% from community service referral. So here now, please allow me to ask the questions. How many of us here use WeChat as one of your marketing communication platform? Please raise your hand if you do. Okay, sort of. Now, I see so many not raise your hand. Maybe because I haven't asked you to turn on your camera. Well, just kidding. Well, but I guess a lot of us here have never heard of WeChat or never used WeChat, or or you might think, well, why do I use a social media platform that mainly used by Chinese people? But well, no matter what reason, I understand and I agree. But what I see here, and also reflect to the survey we've done, I think we might yet to use a community strategy that effectively reach to this Chinese community group. So unless we use, unless the Chinese community group is not the targeted service group, otherwise, from my marketing instinct, I think I can use WeChat to bridge the Chinese community migrants community. And so since then, we have created 209 community posts with average 500 reads for every post, and the highest rate post was 5,800 with 809 shares. And we have 2,000 organic subscribers and numbers of community chat groups, and the number is still growing. And so for the organization, I think it costs and even nothing to reach the Chinese group. And for the community side, I think the Chinese migrants can know, where are the accessible and available supports that they can get. And so this is what we do. Yeah, I'm happy to chat with any one of you, after.
So, folks, I bet now you're all going, when is Carolyn going to shut up? I want to hear more from these guys. So but it isn't it good to have a big picture framework and then see how it works in action. And Sebastian, that is just such a great live example, because when I've done this talk before, I've had to cut to a video. It's much more fun cutting to real people. And also, just to, you gave such a great example of what you do, but also how you use the object of social media, and in particularly, as you said, the right platform, because that's the bit we can sometimes go, oh yeah, social media equals Facebook, job done, moving on. There's more to that. So I'm going to share my screen again. Let's see, it should be here. And go to slideshow. Beautiful. So we've met some connectors. Oh, this is a beautiful photo of a connector we'll be meeting soon. So I've talked about why people are hardly reached, what a framework looks like to work with connectors, and I guess so I had a set of formal research questions, but I would say my informal research question became, if this makes so much sense, why aren't more people doing it? You know, surely it's obvious. Connectors are a resource hiding in plain sight. I've shown that you can go into a community and it's not that hard to find a bunch of community connectors. Once you know what you're looking for, ask the right people, you'll get the introductions. And people are very forthcoming and surprisingly generous to share their time and telling you about what they do and why they do it, if they think that will then help with other connections and will help other connectors. They might get to learn through it and all of that sort of thing. But any of you who've been involved in, trying to get policies up and off the ground, you'll know for something to work, it has to be technically feasible, like it has to stack up. But it also has to be politically acceptable. The decision makers and have to support it as well. So now we're getting to that takes us, I guess, right back to our own organisational boundaries, because they tend to be the roadblocks. So when I ask connectors and staff as well, basically simple sort of questions, when you're working well with an organisation, or what does that look like? And when you've been really frustrated and not able to sort of penetrate through the boundaries into an organisation, why has that been? Or when an organisation has found you and gone, awesome, you're our local community connector, why has it all gone pear-shaped? And from staff and connector point of views, fairly similar sort of commentary. So not surprisingly, the things that make it work, and they don't happen in order. They're sort of three sorts of conditions that you need. I might see if I can take you back through the slide. This is risky. So when you're thinking about enablers and barriers, think about what your organisation needs to do to be connector friendly. So, that's your sorts of things like, do you have a strategic plan that talks about engaging with people that are hardly reached? Do you have position descriptions that give people time to engage with connectors or hardly reached people? Do you set people's annual plans or team plans up to say, your challenge is to get your services beyond the usual suspects? So do you actually set people up to do this work? Do you have an organisation that will then respond? Because there's no point going out and finding connectors and hearing from them, as Dilnaz has said, if you're not prepared to then change and adapt and respond. So they are all elements of being a connector-friendly organisation, being flexible, adaptive. The next space to think about is what works in your relationship with the connector. You're not there to co-opt them. You're not there to, even though we're talking about, oh, this gives me an identity, if I could frame myself as a community connector. First and foremost, you're a business person, you're a mum, you're doing a whole bunch of other things in your life. You're not staff of this organisation. It's great, you've got the common interests of wanting to get more services and appropriate services to people, like Sebastian gave us the example. But you're doing it on your terms and in your time. And so I came across a really beautiful word that, now Bway, you talked about co-design, and a word that really illustrates that quite beautifully, I think, is accompaniment. So one of the connectors, I asked him about, how do you draw people who are new to your community into the life of this village? And he had lots of examples. He said, well, it's really about accompaniment. It's about walking alongside people, not telling them what to do, finding out what they're interested in, and then responding to that. And that's what co-design is, and that's what a good relationship with connectors looks like. You're accompanying them. If any of you are musicians, you know if you're accompanying someone, you don't go off and just change the tune halfway. You've got to actually you've got to be in rhythm, in time, and responding to whoever it is you're accompanying. And working with connectors is just like that. Find their rhythm, find what they're doing, and accompanying them. And so then the third set of sort of enablers is there's a lot of opportunities of what you can do with connectors in the community space. You know, if you've come across a group and it needs some help to get a website set up, do it. Print their newsletter. Provide a bus to get kids to the homework club or the after school program. Provide a meeting room. Bring your programs or your information into their space. And that can be online spaces as well as practical physical spaces. So I'm just taking you back. And of course, when you think about barriers, they are, for connectors, very personal. It's the time, it's the burnout, it's frustrations of dealing with red tape. Concerns that I've got a really lovely thing going in my community with some people who've been quite fearful of some services in the past. If I engage with you, how do I know as a service provider you're sort of getting people to fill in forms and give their personal information? There are, you know, can be real concerns about that. So you've got to be responsive to those things. Staff definitely talked about workload pressures, restrictive funding regimes and policy environments. I'm going to take you through a few examples of where I've put this into practice in my own work life, and that will sort of take you across, I think, a bit more of what those enablers and barriers might look like. So the first is came straight off the back of having spent 3 months in Ireland, found and interviewed an amazing group of community connectors that were sitting there in the environment of the local organisation I was partnering with. I took that sort of summary to the CEO of the organisation, and he said, well, awesome, what do we do next? I said, well, all of these people have said they just don't know enough about your local service system. Some of them have been proactive and lucky enough to either be or have people, partners or so on in the health system, and that's given them an entry point, but really it's a bit opaque. So they did a very simple thing and held a connector forum, and it was over lunch, it was connector led, and it was for the purpose of introducing connectors to a range of local service providers and giving service providers a bit more insight into what all this awesome stuff that's going on under their nose in their own communities, and where there might be opportunities for some accompaniment or some collaboration or some co-design, whatever you want to call it. Out of that, connectors were equipped with a beautiful contact list that they could use in their day-to-day interactions with people who had been hardly reached by services. This included a whole range of multicultural groups. You'd be surprised in Ireland, in one town of 5,000 people, there were 40 different language groups. The whole scene in Ireland has changed in the last 20 years quite considerably. And some further follow-ups of supporting young people with mental health problems. So there was a group that had some relationships with some young people and were able to tap into some local services. The next example I want to give you is in Castlemaine. So somewhere I've lived for a long time. I'm not living there at the moment, but very connected to that community. I was on the board of our health service, Castlemaine Health, for 9 years, and also on the Community Consultative Committee. And I was quite instrumental in forming a partnership with our community health service and our local government and a few other players. And this was while I was conducting this research. So I sort of said, guys, I'm doing this work in other communities. Might be quite nice to apply it in our own community, and did have support for that. And so we agreed, yes, let's have a bit of a structured process to, as a partnership of services, find our local connectors and get a better understanding of why people are hardly reached by our services and how we can be more accessible as a local system. What really surprised me is how long this took. It really did surprise me. So I had a very authorising environment. I had the support of all the CEOs, the boards, the Community Consultative Committee was on board, And I think that was in about February of 2019. And we said, yep, let's have a connector forum in June. Well, we ended up having it in October. It took that long to find people, particularly within Castlemaine Health, which is a more clinically focused organisation, to find the staff, to find the right staff who had time, staff who had flexible enough roles to be able to say, yes, I could definitely be at this connector forum, and I definitely could be open to an ongoing relationship with the connector. So that did surprise me. The way we helped it work, though, was we had some structure. So we formed a working group with staff and the Community Consultative Committee, who pretty much were connectors. We did a bit of a whiteboard. Who are some of the groups that are hardly reached in our area? Do we know a connector to that group? Sometimes we did. Or do we know someone who could introduce us to one? Yes, we did. We divvied it up according to where our sort of relationships were. We had an information sheet. We had a little phone script that we could use when we rang people to say, oh, hi, I'm Bev from the community committee. We were trying to get better access to services. We're looking for people who are connectors and we think you're one. Are you interested? Blah, blah, blah. Cut to October, we had gatecrasher connectors in the end because connectors invited connectors. We had about 25 connectors and 25 staff. It was a great way of bringing people together. That was 2019. Our follow-up forum was meant to be in March. It was of this year. It was COVID. We went online. We did 2 Zoom forums with our connectors, and we asked them, what are you seeing is impacting on the people with the groups you interact with? What information do they need and what can we do? And it was actually quite a capacity building experience. A few of them, the leader of a mental health support group had never used Zoom before. He went, oh, I can do this. And then subsequently ran his group through Zoom. There were 2 folks from the seniors radio group, again, had never been into breakout rooms, which do freak you out a bit. Went, oh, this is cool. And so that's something they've used. But also it was a great way to get more information. Connectors were sharing information with each other and with the health system as well. Obviously, where I'm working now, Merry Health, I'm really pleased to have landed here and see lots of great work with connectors, more in the paid space. So with NDIA, with stepped care, which is mental health for older adults, living well and aging well. But we do actually have relationships with a whole range of informal community connectors, like the people from my study and like the people we're meeting today. And one of the great things we were able to do is get 8 of those people to make short films about their experience of getting tested for COVID and what that was like, encourage other people to get tested. And they've been shared on YouTube in 8 different languages and a great resource. So there's a good practical example of working with connectors. So I hope that's taken you through a bit more of what some of the enablers and some of the barriers are. And importantly for connectors, a connector-friendly organisation to a connector is one where you can find staff who are available, responsive, work with you as a peer or a colleague, and really understand and value the work that you're doing in the community and find ways to work alongside you, to accompany you and support you in your work. And it's amazing the things that can come out of that. So I'll cut across again to 2 more connectors and then I'll summarise. So it would be great now to hear from Jaya. Where are you, Jaya?
Here I am.
And Jaya, we're particularly interested in the part about the making it work. So if you could really share your perspective on what makes connections with organisations work and one successful connection you can give us an example of.
Right. So I'm actually speaking on behalf of a connecting organisation myself. So I'm representing Indian Care, which is an organisation that I co-founded 7 years ago, because I noticed a gap in the connection of people from Indian community into services. And that's because of various reasons. The tagline for our organisation, Indian Care, is connecting and culturally sensitive. And I think that links well to the forum today. And I think an organization, a connecting organization such as Indian Care, offers visibility, it breaks stereotypes and stigma, it offers cultural and linguistic sensitivity and a robustness, which I think makes it quite effective for people to connect with our organization from our own community, but also from mainstream and other government organizations. As you know, the Indian community is hugely diverse and we speak 22 official languages and hundreds, if not thousands of dialects. So while this diversity, it adds a lot of richness in our community, but it does make it hard for mainstream organizations and particularly governments to tap into our community. So certainly Indian Care has been relied upon heavily during this pandemic to promote health messages into our community, to provide emergency relief and other supports that we could offer during the pandemic. So we've been really busy. I think as a connecting organization, we feel that people can feel reasonably confident to contact us and access us because we have a team of people that are available from 9 a.m. to 5 p.m. every weekday. And they can expect to receive a dependable and professional service from us as a connecting organization. But having said all of that, I have to say that we as a connecting organization rely on informal community connectors in our own community as well. So it's sort of two layers there. But I think it's important to recognize that informal work that's going on as well in our community. An example that I can give you into how we reach into our community, we try and help as many people from a range of diverse backgrounds, whether it's age, gender, language groups. But one example is the older people who come here with very limited English language skills, with little money, who are here on temporary visitor visas because they've been brought here to mind grandchildren. And these seniors are desperate for social support and often just meet in parks in the heat or the cold because they can't afford to meet in proper venues. So Indian Care reached out to these groups in the southeast and the western suburbs of Melbourne and offers them social support programs, English language classes, and health and wellbeing sessions. If you want to know more about our connecting organization, Indian Care, it's www.indiancare.org.au. But I can speak more about it in the afternoon in the breakout rooms.
So I think that's really useful. You've described a connecting organisation and also talked about layers, because that is part of the messiness and also the beauty of what we're talking about. And that's why this work it's useful to have a way of thinking about it, but you do need to keep pushing through to see more of those invisible and unseen boundaries that are visible to a connecting organisation. And then, as you say, our community is there's not just the Indian community. There are layers and communities and boundaries within that. And that's why even a connecting organisation needs its informal connectors. So thank you for explaining that. We're going to Manal.
Manal.
Where are you, Manal?
Hi, I'm here. How are you?
Oh, lovely to see you again. So Manal, we would love to hear from you a bit about what you see makes an organisation connector friendly and one successful connection you've been able to make with an organisation.
Yes. Hi, everyone. Thank you, Caroline. My name is Manal Tahir. I came to Australia in 1996. When I came to Australia, I have I have two kids. Both of them, they born 2001 and the other one 2003. So for me, it was very hard to, as a mother, to look after my kids by myself, and I wasn't connecting with because of the language barrier, because of changing everything, because I came in Australia in 2000 and I came to, like it was very hard for me. And then after a while, I had my little child, which is 2016. So I was worried that how come I'm gonna raise this boy. I don't want to get depression like what I did with my older kids. So I start to go to mother group in MAPS in Glen Waverley, and from there I learned something, what is connecting, what to be connecting with people, what to go out. I feel different. I didn't know about it before, and yes, it taught me a very good feeling. I said, wow, it will help me to raise my kids, to be to look after my family. And then this connecting take me to meet Fiona Reid, and she's the one, she connect me with a lot of good stuff. So I learned how to go. I went to 2019 Open Door program, and yes, and at that time I learned a lot of things, a lot of things about my personality. So that's, I like to people, I like socializing, I like to contact with people, and it helped very much, like to be a mother and to look after your kids by yourself. It's not easy. It's not easy at all. So it's good to share with people. And yes, I'm lucky to after, like when I was far away from people, to open and become connected. And Fiona and Alex show me and teach me how to do. I follow them step, and I start to tell people about how to be connecting with anyone and to help them. So for me, like to be isolated and not connecting with people, it's like a newborn baby. And I go out to the people to follow Fiona and Alex and all that good people, and even Marissa Pride. She always give me a good courage and good advice. So all these people, I follow them. So I become one of them. It's like connecting. I learn from the good connector how to be a good connect.
Thank you. That's actually a beautiful way to really summarize the whole process of how your own experience can motivate you to then become, as you say, a connector for other people. So Manal, are there examples of where you've connected other mums or other families into services because of, or into just your community because of your experience?
Yes, I learned how. I did a mother group because I know, like, I've been having hard time to reach to look after my older kids. I know how they can do it. So we have a mother group. Go with Victorian immigrants, refugee. We did a mother group in Clayton community, and a lot of mom, different nationality, and. I know how to bring them because I learn. I like to cook. I like to do sweet. So by my sweet, I mix my talent to bring people, and they love it, and we enjoy. And if they, they believe me, because whatever they said, I've been through it. So I teach
Yes.
them what I've been through. How to be easy to connect and go out. You can't do it by yourself. And yes, I have a beautiful community, like 30 mom in Clayton with the kids. We all came. And one of them, she said, I feel like we're going to mom family, which they don't have family.
Yeah.
So it's about, family.
Thank you. Thank you so much. So I hope everyone today we've got 100 participants, I can see. We will break for lunch fairly soon after Q&A, but after lunch you can hear more from Manal and from Jaya and Sebastian, and a couple of other connectors we'll hear from before lunch as well. Really encourage you to stick around, because you can learn a lot from even hearing from Manal's experience. People have their own talents and abilities, but what organisations can do is, this is a great example of, it was the opening doors that was provided, that training that just moved you into another space, and now you've got these 30 women coming together. They feel at home, they feel included. That is amazing, and that might not have happened, and probably wouldn't have, without the intervention or the support of an organisation that supported and connected you. So that's, oops, I nearly hit the leave button, not the screen share. Why did I not do that? Back to screen share. I want to very quickly, and each time you go out of screen share, it takes you back to the start. There you go. I want to just very quickly, I said that I would be telling you not just about a framework, but a model. This is a very simple 3 stages to a model for collaborating with connectors. And the way this came together for me was actually makes a lot of sense when you think about it, because it replicates completely what connectors do in the community. And if you want to work with connectors to access and engage with hardly reached people, it makes a lot of sense, as I said, to accompany them and to mirror their processes. So just like connectors identify a gap, a need, an opportunity, they connect with people, they enable people by providing support, practical education, whatever it is, a mum's group, a cooking group, a walking group, those kinds of things. As healthcare staff or any social community services staff, we need to identify connectors, know who they are, know what we're looking for, ask the right people, connect with them, and enable an ongoing relationship through that mutuality, supporting the activities that they undertake in their own community. And that joint training is really important too. So what I want you to take away from this, because that's always good to go, oh, someone says, oh, what did you do today? Oh, I went to a forum. Oh, okay, what did you get out of that? Well, it turns out this stuff I've been doing of working with connectors makes a lot of sense. There's actually an evidence-based framework for it. And I've got the evidence for that now. And the simple model for working with connectors is about identifying them, connecting with them, and enabling those relationships. And because I've got that evidence-based framework that takes what I do from a good idea or, oh, it's community development, it's community engagement, yes, it is, but here's a framework for a particular way of identifying and tapping into this amazing resource that is in all of our communities. There are people that are aware of the invisible and unseen boundaries that mean people are hardly reached by our services. We can and we should go beyond the leaders in accessible people in communities and work through them or connector organisations to get to those less seen, less visible connectors who can really make a difference in building access to our services. So there's an evidence-based framework that can be used, and I've shown you how it was developed, a bit about how I've put it into action, and you heard from connectors themselves about how this works in their own life and experience. So we want to go to Q&A for a bit, and then we'll hear from a couple more connectors after that. So Wei, you get to, Andrew, you get to run the Q&A.
I think, boy, we're going to swap the names today, I think.
Yeah, sorry.
That's all right. Everyone, thank you so much for just staying in there, being so attentive to this incredible presentation, and also hearing from our connectors themselves. And I think if there's anything I can take away also from the connectors themselves is reaching out to people, to communities in the way that suits them. And that why for, the Chinese community is that, it's not every social media platform, it's that particular platforms. And if there's anything else as well from the community connectors, is that we love what we do. So whenever you feel stuck in your work, please reach out. And all we want is to make sure our community is well supported, and making sure that our supporting organizations are not stuck, when they need to do the job that they like to do. Alex, we got some questions. Thank you very much for putting those together. Not putting those together, but they've already been put in there, and you've been sorting them out. Have you got some questions for Carolyn, please?
I do. Thank you so much, Andrew, and good morning or good afternoon, everyone, just on 12. I'm Alex. I'm really proud to be part of the organising group for this event and coordinate the Opening Doors program. I know there's been a bit of talk about opening doors, so what I might do is pop a link into the chat after this if anyone's curious to find out more. There have been a few questions coming through, and I'd really encourage you in this time we have to put any questions that you might have in the chat box. The owner from Maroondah asked some time ago, copy of the presentation. So yes, I think, Carolyn, we can do that, and we'll also get the recording of this out to everyone as well. Lawrence from Access Health and Community says, you've worked across a lot of different communities and countries. Are there characteristics of some communities which make them more connected than others? That's a really interesting question.
That is an awesome question, and that's a whole other PhD, but I asked that myself, and it's to do with social infrastructure. So characteristics seem to be where I actually call it a connector culture. So in one, because particularly in Ireland, there were two communities 30 k's apart, really easy to find the connectors in one. It took a lot more time in the other. And what I looked at, well, okay, what's the difference? The community where I could easily find connectors had a very strong civic society, like they had a strong community council. They had won the Pride of Place for all of Ireland, so they were very proud of their town. So there was a whole range of really active, visible leaders, as well as these less visible connectors. There were people that had, so I guess they had some strong cultural capital and strong, lots of resources and some good operators at the community who could draw on that. They had forged some very strategic relationships with local organisations that had money, like the local development company, and they'd use those to run more community building activities. They also, so that seemed to me to be one of the factors, was this presence of community leadership and how that had been cultivated, for sure.
Fantastic, thank you, Carolyn. Another question, Kathleen from HIC, I'm going to take a punt and say that's the Health Issues Centre, says, interested to hear a little bit more about the distinction between paid and volunteer connectors. So wondering if you could maybe just elaborate on that briefly.
It's about sort of whose agenda is being run. So if you're paid, you have a position description, you're accountable to your organisation, and you're embedded. You may have those great connections and relationships in the community. That's why they've employed you as a connector. But nevertheless, you are strongly aligned with the organisation. That's who you're accountable to. If you're an unpaid connector, you're running your own show 100%. You're accountable to yourself, obviously, and the trust of the people who open their lives up to you that you connect with. But it's a different starting point. In terms of skills and abilities, probably not much. And in fact, people do move between both of those roles. And you've heard from, you'll hear from some of the connectors today how they've started off in voluntary roles and ended up in those paid roles. But it's the agenda, and it's the ownership, and it's where you are most aligned with the community or the organisation.
Thank you so much, Carolyn. There's a couple of questions coming through on a similar topic. So Jeff Deacon from NDIS asked any tips on how to find community connectors, and Elise Angela has also asked how to reach beyond the gatekeepers. So there's a sort of a question there about how do we find and identify them.
Yeah. I do go back to, you don't see something unless you're looking for it. Like I remember years ago, we decided to buy, we got a border collie dog, right? I didn't know there were so many border collies in the world till I had a border collie, and they're everywhere, and they're beautiful dogs. I don't think there's more than there used to be, but now I'm aware of them, I see them. So that kind of sounds silly, but it's really true. You've got to actually know what you're looking for, value it and appreciate it, because then you will see it in quite unexpected places. Connectors don't have a badge or a t-shirt or a hat though. So it is, as I explained, the process I used in my own case studies, and then we did really quite systematically in Castlemaine, was we define what we're looking for. A connector is someone who knows some of the people that are just not connected in our community. They link them in with other stuff. Who are those people? And then you generally can't get to them directly, so you go to the people who know them. So you'd speak to there's a particular footy club we were really going, if we could get onto those guys, that would be great. There were gatekeepers, definitely, at the footy club itself. So we spoke to the recreation officer at council, said, who are the actual connectors in this club? And she said, oh, that would be blah, blah, and blah. You probably wouldn't want to talk to blah, blah, and blah. Yeah, okay, thank you. So you've got to tap into that local knowledge, because I did have another connector said, oh, so-and-so, she knows everything. Yeah, but she is not a go-between person. She is a go-to person. So you've got to be guided by the knowledge, and be very careful, obviously, to be respectful. You're talking about people's characters and lives. So, it has to be done respectfully and with confidence.
Thank you, Carolyn. And Dilnaz has just built on that in the chat, saying often community connectors might not be official in the positions that they hold. There was a question earlier, just a little bit around language, and I guess there's two lenses to that. There's language from a culturally and linguistically diverse perspective, but then there's also something about the language. You know, some organisations might use quite bureaucratic, inaccessible language, so there's another barrier there too. I wonder if you could talk a bit more about language.
So I think language is one of those boundaries that occurs at every level, at organisational, you know, social and cultural levels, and certainly to be aware of, which is why, and I think to some extent we can learn to speak each other's languages and we can adapt to a degree, but something I meant to say is often people who are connector organisations or connectors themselves are like translators or intermediaries. And so they're more adept. They can fill in a funding application form and use all the funding words, and they can hang out at the mums group or the footy club and be comfortable. That's that whole thing of being able to span boundaries and operate effectively in different settings with different languages. So I don't think we can ever totally get rid of all of those differences, because that makes us who we are. But that's where boundary spanning connectors and staff members as well are really useful. So we adapt and we adjust. Like Dilnaz said, you're a tailor, you adapt, you make a different sort of garment with your language in different places.
Thank you so much. We've just had a great question come through from Lara Clark, which I think will be sort of leading us towards a bit of what we're going to explore this afternoon. But Lara says, any advice for advocacy within health services for embedding community connectors within the organisation?
Yeah. You've got a beautiful thing in health services. Use your quality guys and use your national standards, your accreditation, because the national standard, standard 2, that is actually a tough nut to crack. And I'm sure, and I know this is being recorded, but so often it's really hard to walk the talk. And we say, oh yeah, we engage with hardly reached people. Yeah, because someone from some different group came to one of our events once. Is that real? So I think that's where you've got a real opportunity to use the instruments that you already have to use, but say, look, we're obviously stuck on this. How about we wanted to get the award for being Best Health Service of the Year? If we did some work with community connectors and we could show we'd really meaningfully engage with some hardly reached groups, and we changed our service, and we had better health outcomes for this group, and on top of that, this and this happened, and the connectors then went on and did their TAFE course and you've got stories galore to work with. It doesn't take long to stack up the good stories. So there's a couple of, I'm trying to keep myself to short answers, but go back to your mission, values, strategic plan, funding guidelines. They will all say stuff about place-based, co-design, co-production, going, okay, you want some co-design? We need some connectors at the table.
Fantastic. And we might just finish on one last question from Mukles Habash says, what are the most challenges community connectors face? And again, I think we might explore that this afternoon, but maybe just insights from your research, Carolyn.
Definitely a lot talked about banging their head against red tape and just finding that even challenging in their own self-driven work in the community and then trying to cross boundaries into the health system. And the other one is sort of time and just managing their own energy, because it's amazing what they'll set up a Facebook group or but moderating, administrating it, you know, just to keep the energy going, and just managing those ebbs and flows in your own energy and availability is really important.
Absolutely. And we know one of the things from the co-design process that led to this workshop, and Dilnaz spoke really strongly on it, is around those personal boundaries. And I think we're going to hear more about that this afternoon. It's 12:10, so thank you, Carolyn. I might pass back to you, I believe.
Oh yeah, so now I get to introduce our last two connectors to hear from before lunch. So good thing you can't see my desk, it is covered in papers. But now we get to hear from Ivy and then from Nang. So we'll cut to Ivy. Where are you, Ivy?
Hi.
And Ivy's going to give us just a lovely summary of who you are and what you do, Ivy.
Yeah, sure. Yeah. Hi, everyone. My name is Ivy Wong. I migrated to Melbourne from Hong Kong 4 years ago with my husband and daughter. And actually, I am the typical example of both paid and unpaid connector. I am currently the program coordinator for Chinese Peer Connection at EACH. This program provides support for people in the Chinese community who are experiencing gambling harm. And I am also an active church leader in a Chinese church located in Melbourne's eastern suburb. I feel strongly that a person with lived experience can be a good connector to the community. Let me introduce a bit about my service of Chinese Peer Connection. That is one of the difference. If you get paid, you won't really introduce it to people so that people can use it. And Chinese Peer Connection are funded by the Victorian Responsible Gambling Foundation. We provide free telephone peer support service for Chinese who are experiencing gambling harm. The one thing that Pay the Connector can do is we can use the funding to train our volunteers. I can see that our volunteers are also community connector. They are with lived experience of gambling harm. They will deliver phone call to those who are affected by gambling, and could be the person or families or friends. We have the telephone line that is operated by staff, and after matching with suitable volunteers, our clients will be scheduled regular telephone support in their language. We aim to take the stigma and shame out of reaching out for support, with a key aspect of our model being a peer-led approach. We see all our volunteers as having a community connector role to some degree, and this is very crucial of the program success. And I am also a volunteer at my church. In order to connect to the Chinese communities, we found that cultural activities are the best engaging points. Last year, we organized 6 events. The most effective tools to link Chinese people together, or maybe other people too, are through food. We had dumpling, mooncake, jelly flower making workshops during Chinese festivals. We also joined local events organized by local councils to reach out more people. And during the pandemic, our church volunteers provide support calls for those who have joined in the past events, and to offer support to them. We use different social platforms for communication, just like Sebastian mentioned. We also use WeChat, we use WhatsApp and Facebook, and they are all easy and free. And thank you. That's my introduction.
Thank you. Thank you. That's fantastic. And so good to have that example of the paid and unpaid connector, and just the distinction between those roles. And I suppose that's something else I found is an enabler is in your organization, you will have people who are connectors in their real life, natural life. So tap into those guys as well, you know, and because you have staff who will know connectors and actually understand intuitively how this works and can explain the value of working with connectors and working with. It's not getting them to work for you. We're talking, today's forum is about, there will always be spontaneous, this phenomena of people, as Andrew said, who just love what they do because it's important for their communities and people in it to thrive. So this is really about how do you find those guys and work well with those guys on their terms, and not wreck it by trying to turn it into a program with KPIs and, you know, all those things that we love. So our lucky last connector we're going to hear from today is Nang, and she is an international guest at our forum. So Nang's just completed a 48-hour journey and has just amazingly got up despite the different time zone. And Nang's going to tell us a bit about your experience of how would you describe yourself as a connector, Nang?
Hi, everybody. I'm so humble and grateful to be here. Thank you so much for having me. And yes, I'm now in Laos, just arrived 2 days ago, and in quarantine at the moment. So yeah, I am a former of international student. I study community services, and I feel so fortunate to choose that course. And Yeah, I would like to tell you more about what I have been doing. So I do a lot of volunteering works with different organizations, but mainly to support international students. I think the reason is because I have my sort of life experience, and I also understand how it feels like to be international students and what problem and difficulties that we actually encounter, and how hard it is to stay and live in different country using different language and sort of live in different culture. And I think what motivates me is the sense of fulfillment. And I would like to give you one example of my work, which is a sexual health conference. And I also would like, before I explain about that, I would like to acknowledge Marisa, Alex, and all people in the opening doors and my connection that I have that make this conference happen and make me a good community connector, if that's possible to say. So yeah, so sexual health conference, it's come from my own experience. I get sexually harassed in Australia and also in Laos, but in Australia, it really affect me severely mentally. It's not severe harassment, but it affect me severely, consider coming from conservative country. So it was very painful and a lot of trauma going on. So I was thinking, wow, if this happened to me, it may as well happen to a lot of international students. And we are in different country. And I feel like I have a lot of connection with the community, but I still feel the sense of trauma inside. How about those who don't have that connections? How can they sort of go through this? So I sort of reach out to all the connections that I have. And finally, I sort of work with the Council of International Students Australia, Study Melbourne, state government organization, and different organizations and specialists from Victoria to come together to create a conference. We do it online 5 sessions straight because of the COVID, and to educate international students. And through that, I can see that, wow, yes, I am community connector because I connect different organizations to come together to support international students. At the same time, I also connect those organizations as well. So yeah, it has been a journey. And I think apart from that, another motivation is the connection that I have with the organizations and people in the community. It really makes me feel alive. I can't believe that a lot of people in the community actually willing to help international students and everybody. I couldn't imagine until I actually connect with them. And another thing is my personal growth. I feel like I live outside the box. I challenge my potential, and I feel that I can learn so much from just helping others and connect myself to others. And one more thing that I would like to mention before I finished this is, I think, I hope, and I think a lot of people here would like to support international students. But the only one thing I think is the gaps between the community and the international students. I think that gap that we need to close. And I think Kate has been working very hard actually to close this gap. And I think if all of us can come together and connect with the universities and educational providers, it will be great because international students have very close relationship with the educational providers. So if we, as the community organizations and services providers, can connect with international educational providers, then it will of course like close this gap. So yeah, thank you so much for having me.
Thank you, Nan. We're going to hand back to Andrew to wrap us up and get us over to lunch. But such a great, you touched on your motivation and what you do and the benefits that you see for yourself and for other people. So thank you. Very powerful story. Andrew, over to you.
Wow, what a morning that was. Exactly why we are here. And thank you very much once again, Dr. Carolyn Wallace, for putting into perspective the role of the community connectors, and also how the services providers can utilize this awesome role to make sure we are meeting the needs of the people that we serve. Thank you to the connectors for sharing your experiences, but also your passion for why you are a community connector. It's a role that comes from the heart. And given that it comes from the heart, that's what I said before, services, make the most of it. And I think that just make a good day when we all go home knowing that we'll serve the people that we are meant to be serving. And sometimes we may not know how to do that until we actually engage with those communities. Thank you, Alex, for facilitating that questioning, and thank you to the people that asked the questions. Keep that chat box very busy. I can see some great comment there. We can't pull them, we can't pull all of them out, but if you get a chance, just scan through. There are some great resources there and some comment. Also, there are links to some of the community organizations that being represented here, also represented by community connectors themselves. So during your lunch break, please scan through them as well. Also, all these awesome resources presented by Dr. Carolyn is also on the website as well. That website link is also there as well. And what you've heard, for the first part of the forum, please process it during your lunchtime. That's why we are using the afternoon to just come together. You will have a good half an hour, to talk to people in your group. And there will be community connectors there themselves as well. So the afternoon is really to hear from you as well. You've heard from us, and the afternoon is really to hear from you and also from each other. Also, at the end of the forum, we would also like you to complete a survey monkey. So the link will also be shared there as well in the chat box. That's another important way of hearing from you, and that's also for future training purposes as well. I'm not going to hold you for too long. Thank you all very much. We will be back and start the forum at 1:05. So please have a good break, and we look forward to seeing you soon. Thank you.
I'm really disappointed that none of you have got to taste Manal's beautiful cooking. Manal has usually brings something beautiful along to eat and share with us all. So I hope one day we all get to experience that together.
Yes,
Definitely.
thank you, Marisa. I hope so. When I see the photo, I remember I said, if this is a real meeting, I would bring it, of course.
I remember having it at the Open Doors event last year. Was it, Manal?
Yes, yeah.
Beautiful, like Wei was referring to, beautiful.
Yeah.
Sorry, absolutely beautiful, delicious cakes with the Arabic flavor. Mashallah, beautiful.
Thank you.
I don't know if that is the correct thing, Manal, but when I was in Dubai for many years, Manal means achievement or like precious. Or,
very well, yes, it is.
And when you were talking, I was almost going to write it and say, well, there you go, lady, you've achieved.
That's so beautiful. Thank you. Exactly. I explain all the time. My kid, I always explain to him, but you did it very well. I make it easy. I said to them, target or achievement. And he said to me, Mama, is Target shopping is yours?
All right. Okay. Oh, that's cool. Those are the things that we miss during the lockdown, and we can't wait for post-COVID so we can have face-to-face and enjoy the food and music and maybe dance as well. We can't wait for those moments. So I am a community connector, and I'm very proud of it. And I think my community connector interest started way when I was at uni. That was many years ago, so I don't want to say that will make me very old. But I was, as I was studying, I went to RMIT, and we were blessed with a lot of international students. So I was one of the students that put their hands up to be a mentor for the international student. So, and that is just to introduce them to the campus and also to the beautiful city of Melbourne. So I really like that as well. And also during that time as well, I was part of the Monarch Young Persons Reference Group. And that was the first time I met Fiona Reid. And I was really privileged to be part of that youth reference group. And I think since then, we've been staying connected with Fiona, and we met again in this forum. So thank you, Fiona, for your coaching and mentoring at that time. But it was an opportunity for, for me to be part of that youth group, that youth leadership group, but also be able to reach the young people at the city of Monash at the time. I also got my first job out of uni. It's actually 9 years on Sunday with Anglicare Victoria. And that provided me an opportunity to work with the community. Started off in residential care, also worked with asylum seekers, with families, and now in family violence. So, and while I was working, just doing my job, my colleagues would come to me and say, "Hey, Andrew, do you know any African family support service? Do you know any African youth mentoring program?" And I had to start thinking, so when people come and ask me, where should I send them to? So that also provided me that opportunity to look around as to what can I do personally, or how can I just make myself aware of what services are there so I can point people to. Part of that as well was that I also co-founded an association called the South Sudanese Australian Academic Society. And we've mentioned quite a number of times during the day how the community connectors role has become very crucial during COVID-19. And what we've done during COVID-19 is to run community forums every Saturday night just to engage our community. I'll just see if I can put in our Facebook link. All right, it's there. So that is just to engage our community, but I looked at it as not just engaging our community, but also bridging the gaps between our community and other multicultural communities here in the Southeast. And that is the role of being a connector is not limited to one thing. It can be quite broad, and you can help in many ways. So our association have been able to work with other communities, but also helping other services to reach out to our community in that sense. And that is just to expand and also be able to make the job of supporting our community a lot easier. I remember just a few weeks ago, I had a call on Sunday afternoon. The Department of Health and Human Services wanted to talk to a community member, about quarantining at home with COVID-19. And language barrier was part of it. Understanding what he was being asked to do was part of it. Understanding what needs to be provided to this person in order to stay in their house without going outside. And to be able to play that role of promoting, sort of making communication easier with this person and the Department of Health and Human Services, was just something I look back and was like, you know what, if I can play a role in the community to help out in getting this COVID-19 under control, it's a community challenge, and anything we can do, small or big, it's just going to help all of us to get this under control. And sometimes you don't know what it is. You just get a phone call and you just felt the need, you know what, I'll just step in, and I think that's how we all feel. And I said in our small group, when we are in community services system, we are all community connectors. We are all community connectors. The only thing we are different is that we are connecting our communities whom some of them don't know how to access services, or accessing services was never part of their culture, and now they are in a country where there's a lot of support. That's where the multicultural community connectors role become unique. But I'll look at all of us here. We are all community connectors, and that is the call to action that as we live today, that we take this back to our practice and to our organization and look into our policies as to, so how can we reach out to these hardly reached communities? And I think if I can just end it there, I think I rewarded myself there with time. Can I ask if Alex could please, if there are some comment that you can sort of pull up from, I can just see it just flooding in. Thank you everyone for all these amazing comments. Alex, are there some of them that you can, not in any particular order just because of time, guys, but they will all be noted.
Good Lord, Andrew, it's coming in so thick and fast. I've had trouble keeping up with it, if I'm being honest. Look, I think a few themes that seem to be emerging are definitely that notion of boundaries. I notice there's a few comments and questions around, and I think Dilnaz, you've spoken about this brilliantly in the past, that particularly if you're working in an informal setting and maybe you don't even have a work phone or something like that, you've only got your personal phone and your personal email, that setting boundaries can be a real challenge, particularly if you've got community members maybe relying on you, often reaching out late at night, on the weekend. So I think very much a work in progress, and maintaining those boundaries, I think, can be a challenge. I do see language has come up as a key barrier in a lot of the conversations, both in terms of accessing services, but also spanning those boundaries. And another thing that's come up, and it came up very strongly in our chat with Manal, who was also singing the praises of Fiona Reid, I can see you down there, is the importance of when a community connector reaches out to an organisation, that there's a willingness, almost sort of an enabling environment, where rather than being met with barriers and boundaries and red tape, that the person they're connecting with says, I see you've got a real passion about this, or let's see how we can make it happen. Not promising that it will happen, but working really hard to make sure that it does. And I think particularly in our group's chat, in Manal's case, her initial connection with Fiona Reid and how enabling Fiona was in supporting Manal with her passion and vision. I hope I'm summarising Manal well, but made all the difference in her getting to where she is as a connector. Is there anything else? I'm happy, Kate or Sharon, if anything else is jumping out at you in the chat. I literally was struggling to keep up with them as they came through. Kate or Sharon, is there anything else that's jumping out at you there?
Very quickly, Alex, and I'm surprised that I didn't mention it myself, and it doesn't seem to have come up in the chat, is about an inherent pillar of honesty and transparency. So if the community connector doesn't have the backbone of honesty to themselves and to the organizations and communities they help, then somewhere along the way, it will show. So I think that's a really important part of being honest, but also being transparent, because sometimes you might be helping both sides of the coin. You know, you might be helping the groups to advocate, but also the government to understand. So it's really important, individuals or organizations, that we don't just perceive to be honest, but that we are truly honest. And sometimes we even have to say no, because there might be a conflict of interest. You know, you might be working in the sector and you're asked to talk about that sector or asked to help. So I think that's something that needs to be noted, that honesty and transparency are key to the success of community connectors as a force.
Thanks so much.
I think if I may add quickly, Alex, to what Dilnaz just said there. When I was asked, like I said before, 2 weeks ago, to help out in communication between the department and that community member, I asked them for that person's name, and also, are they happy for a community member from his community to come out with the department? And those are two key questions. and that's because I may know that person, and the you know, to do with privacy and confidentiality, that may not be appropriate for me to come there. That person may not want to have someone from their community coming out as well. So it just those two things that you know, that sometimes may be called upon, and that honesty and transparency are also very important.
I just wanted to spotlight that last thing, Andrew. Carolyn added a comment. It's really interesting how connectors support and mentor other connectors, and I think we've seen that really strongly too. Manal spoke about the mothers in her group now that they've joined, now they're stepping up into those connector and mentorship roles as well. So there's a real pay it forward thing, I think, that we often see in this space too.
Can I just add, Alex, if I can, that I think it makes it harder for connectors who try to do the right thing when there may be some who might not have those values. And I think it makes it much more difficult for those, that are trying to act out those values. So just need to be really mindful that we do really push those values for connectors.
In our group, we talked about, are we moving? In our group, we talked about the importance of training community connectors, so recruiting community champions or leaders to be able to advocate on their behalf. So one of our group members from Moreland Council spoke about that's the role that they take. Instead of the community having to rely on them as the staff, they're also training other people in their community to be able to support, so to become community connectors. So I think that's really very important aspect, working in the community sector. And instead of the community relying on you as a one person, there could be other heads to help out around. And that also sets out, like, I guess, the boundaries of, you know, you may know the other person who is a community connector, but you don't want to deal with that person. So you can deal with another community connector who is being trained.
I'll just say something. We talked about the diversity within communities and the importance of recognising that and seeing that different communication platforms don't always match up with people who appear to be from either the same migrant group or ethnic background. There's different patterns of migration, there's different countries of origin. If you talk about the Chinese community, that the diaspora is very diverse, and it's important to understand those differences, what's in common, but also what is different, and to respond to that diversity, and not to assume that one size will fit all in ways of communicating and connecting.
And I think one example given, clear example given by Peter was when we use interpreters. We know that we say that language is the main barrier, but then he gave a perfect example of someone who could do the interpretation, like, of the language, but didn't understand the culture. So that's joins what you were saying, like in terms of the Indian culture, there's several languages. In terms of the Chinese one, there's several. You provide interpreters for the language, but also who have an understanding of the culture.
Cool. Thank you everyone for contributing to that session. We are now going to be heading off to our last activity of the day. And once again, thank you guys for hanging in there. And the feedback is just incredible. We only have about half an hour to go, so we are nearly there to the finish line. So thank you. The afternoon session is that you are going to be with two other people in a group of three. And the aim of this is where you will really think about and also talk about your commitment to action, and that is to improve the engagement with your local communities. And I think from all of us, the connectors and the organizing team, it is that when we leave today, that whatever we are taking back, that we can come back in the future when we run into each other, you know, wherever that may be, would be that there would be one thing that you would have said, you know what, I came back and I worked on this in my practice. I also change things in my organization. And you know, when I say I change things, it's hard to go solo, but it's how you can be obsessed with this idea of using community connectors to reach out to the communities. And that is, what can you do as individual? What can your organization do? And I think those are the two key questions. What would need to change for your organization or service to become more community connector friendly? That is another question to reflect on. Can you commit to changing your language from hard to reach to hard to reach when engaging with local communities? Are there any other key takeaway from today, from today's forum that you would like to share? And that is, when you come back, put them in the chat box, or that you can also go and share with your colleague as well when you go back. You will have 20 minutes to talk in the group of 3. We've been really very generous with that time, and that's because we make sense of what we've learned. All right, I think we're all back. Once again, thank you, everyone. What I was saying before we went to the small groups is that when we come back, feel free to put in your takeaways, anything that sort of stood out for you during the day, put them in the chat box, and there will be, they are being paid attention to. So please, that is our central contribution point today. The other thing is, as we leave today, I hope we are obsessed with the idea of community connectors. Okay, so can we all be messengers? Talk about how great this thing is. You know, there are community connectors out there, you know, and they like us to support the communities. And, you know, and they are willing to do that. So it's just something that, you know, even though I'm a community connector myself, I have not been talking about it that much. And I think the more we talk about it, the more you hear your colleagues saying, you know what, I've tried to support this family and I don't seem to get through, then, you know what, have you looked into getting a community connector or speaking to a community connector? And if we wonder what that is, there is a website. Okay, so there's it's just a beginning of journey to be more community connector friendly as organizations and workers. Also, the other thing I've heard from our discussions is that asking for permission to help, and that is a lot of time, the word help and support can sometimes come with stigma for a lot of our communities, and sometimes just asking the simple question, how can I help you better? How can we as a service help you in a way that would be more suitable for you and your family? Okay. The other thing that I've also heard from our discussion as well, and something that also been throughout the discussion, is shifting the language from hard to reach to hardly reach, because there's a bit of blame in that. When we say hard to reach, there's a bit of blame attached to that. And when we think about, okay, so why are these people hard to reach? If we can take that back to ourselves as hardly reach communities, then it then come back to looking into our practice. It then come back to looking into our policies. It then come back to looking into our pamphlets. It then come back to the channels we're using to reach out to those communities, and that is using the familiar channels for those particular communities. The importance of transparency and respecting boundaries as well. That's another thing that stood out during the day. And that is, it's really asking for that permission to help. That's where you then realize those other things, how you can do that better. I will hand over to Kate Jeffrey to summarize and close up the day. Once again, everyone, it's been a privilege and honor to be your MC for the day. I know I've messed up a few times, but you've hung in there, and it's good to come to the end. It's been like I said, an honor. Thank you very much, everyone, for giving me this opportunity. Kat, if you can release us.
Okay, just first of all, thank you, Andrew, for a brilliant job as our MC for the day. We're really grateful for you taking on that role. It's requires constant attention, and Andrew's been part of the planning for this forum, and really appreciate your contribution, Andrew. It's been outstanding in making this a success. It's been brilliant from our perspective to see such a large group of people from across different organisations and communities being here today. Before I get to other thanks, I'd like to acknowledge Fiona Reid, because Fiona has been involved since the start of all of this. She was the inspiration and convener of the Eastern Metropolitan Region Community Engagement Interest Group, and she's been instrumental all along in our discussions around what will make a difference around community engagement and good practice. And thank you, Fiona. I'm pleased to see you there on the screen. I need to thank all of our great community connectors, Sebastian, Dilnaz, Nang, coming in from Laos, Ivy, Jaya and Manal. It's been really a rich experience hearing from your reflections and life experiences, Andrew as well, in this space. I would like to thank members of the, because we originally planned to have this forum as face-to-face back in April, and it quickly disappeared off the radar because of COVID. So it's really great to see that right towards, months later, we are here in this forum. So I'd like to thank members of the Community Engagement Interest Group, Joe, Gina, Marissa, Tim, Iresha, Rose, Belinda and Lawrence, and others who contributed along the way. Thank you again to Andrew, to Carolyn for a great presentation and offering us, the evidence around community connectors and having this forum, having this framework that can be used by agencies to advocate internally for better ways of connecting and working with communities. Thank you. Wei is not here anymore, but I'd like to thank Wei for being part of this, and also Tracy, who introduced it. This forum wouldn't have happened but for the work of Sharon and others at Inner East PCP. So Sharon, Belinda behind the scenes, and of course
Kate,
Brad.
Kate, you too, Kate.
And I left out Alex. I meant to mention Alex. Don't know how I missed that, Alex, but thank you.
Don't forget yourself too. You never mention yourself in anything. Right?
That's right, Kate. You've been amazing.
So it is. I hope I haven't left anybody out, because this has really been a team effort, and there's been a number of meetings with the community connectors who we identified and were willing to give their time, came forward, and so I'm really delighted that we've had this really meaningful engagement in this space. And just finally, I'd like to say that this is about creating more inclusive communities and societies. We really do, our lives are greatly enriched by connection and by that sense of valuing everybody in our community, and not having people who feel on the outside. So that's kind of what motivates me, and I do hope I did mention everybody along the way. But I think this is the end. Alex, do you want to say something finally?
Not at all. Just this has been an absolute highlight of my month, and so wonderful to see all of you here. Such an engaging forum, and just congratulations to everyone who made it happen. I'm so proud of all of you. And maybe one last round of applause for Andrew as our just incredible MC today as well.
Can I just say a quick one? Just to highlight that this was a co-design work that we did right at the beginning. The community connectors were involved with us in the planning, in everything step by step. So we didn't plan it just on our own. So it was like, it's the fruit of a co-design project.
So, thank you, everybody.